The sharp crack of a bone breaking is a sound many of us fear. For millions, a fracture means weeks or months of pain, casts, and life on pause. The real challenge is the healing process. Our bodies are remarkable, but sometimes they need help, especially with complex fractures. Traditionally, surgeons use metal plates, screws, and rods as internal scaffolding to hold bones together. This method saves lives, but it's invasive, requiring large incisions, causing more tissue damage and increasing infection risk. Metal hardware can cause chronic pain, discomfort, and even weaken the bone underneath due to stress shielding. Often, a second surgery is needed just to remove the hardware, meaning more anesthesia, more recovery, and more cost. For patients, it's a double ordeal. First to heal the bone, then to remove the metal. The process highlights a clear need for a better, less invasive, and more patient-friendly way to mend broken bones. Imagine a solution that avoids these complications entirely. What if we could fix bones without permanent metal, without a second surgery, and with less pain? The search for such a solution has driven innovation in orthopedic care for decades. Surgeons and patients alike have long hoped for a method that supports natural healing without the drawbacks of metal implants. The future of bone repair may be closer than we think. A new technology is emerging, promising to change everything about how we heal broken bones. Let's explore the science and potential of bone glue. Imagine fixing a shattered bone without metal plates or screws, just a special substance that bonds fragments together in minutes. This is the promise of bone glue, a revolutionary technology in orthopedic surgery. Bone glue is designed to work with the body, replacing cumbersome hardware in many fractures. The idea: apply a liquid or paste that hardens, holding bone fragments in place and supporting natural healing. Surgeons could piece bones together like a puzzle, dramatically simplifying complex repairs. The glue provides initial stability, then gradually disappears as new bone grows. This means less invasive surgery, less pain, and no need for a second operation to remove hardware. Recovery could be faster and more comfortable, with minimal scarring and lower infection risk. Bone glue isn't just about making surgery easier, it's about transforming the entire healing journey. Patients could get back to their lives sooner, turning a long ordeal into a manageable interruption. This is the future of fracture repair. So, what is bone glue? It's a sophisticated biomaterial, not your average hardware store adhesive. Most bone glues use biocompatible polymers and minerals, like tetracalcium phosphate, mimicking natural bone. The glue is mixed in the operating room as a paste, then injected into fracture lines to fill gaps and bond fragments. A rapid chemical reaction hardens the paste into a strong, solid scaffold within minutes. The glue is bioresorbable. It gradually breaks down and is replaced by new bone tissue as healing progresses. This temporary framework supports the bone during early healing, then disappears, leaving only healthy bone behind. Advanced glues are osteoconductive, encouraging bone cells to grow into the material and speed up repair. Some even include growth factors to further accelerate healing. The glue isn't just a placeholder, it actively guides and stimulates the body's natural repair process. It's a leap forward in regenerative medicine. To appreciate bone glue, let's compare it to traditional metal plates and screws. The old method is mechanical: large incisions, drilling into healthy bone, and clamping fragments with metal. This approach is effective but damages tissue and bone, increasing risks and recovery time. Bone glue offers a biological alternative. Applied directly to fracture surfaces, it requires smaller incisions and preserves bone integrity. The adhesive fills every crack, creating a uniform, stable fixation across the fracture. Unlike rigid metal, bone glue can be engineered to match bone's natural stiffness, promoting stronger healing and reducing refracture risk. Metal plates are permanent unless removed in a second surgery, often causing irritation or complications. Bone glue is bioresorbable. Once healing is complete, it's gone, leaving only natural bone. No second surgery, no lingering foreign material, and fewer long-term issues. This is a complete regenerative solution to bone fractures. The difference is clear: less trauma, better healing, and a future without metal. Surgeons can now focus on restoring anatomy, not just patching it together. For patients, it means a smoother, safer recovery. The era of adhesive healing has arrived. One of the most astonishing aspects of bone glue is its speed. While the entire surgery takes time, the critical fixation step, locking bone fragments in place, can be done in just 3 minutes. This rapid process reduces time under anesthesia and surgical risk. Here's how it works. After aligning the bone, the surgeon mixes and injects the glue into the fracture. The adhesive hardens quickly, creating a powerful bond that rivals traditional screws. For complex fractures with many small pieces, this is a game changer. No more painstaking drilling and screwing. The glue molds perfectly to the bone, allowing for accurate reconstruction. The result? Faster, safer, and more efficient fracture repair. Surgeons can stabilize even the most challenging breaks in minutes. This revolutionizes trauma surgery, making it less invasive and more precise. The 3-minute mend could soon become the new standard. Bone glue is setting a new pace for orthopedic care. For patients, bone glue transforms recovery. Less invasive surgery means less pain, less tissue damage, and a lower need for strong painkillers. Patients can move sooner and start rehabilitation earlier. Unlike metal implants, bone glue dissolves as new bone forms, leading to a more natural, integrated healing process. The end result: a healed bone, not a bone with a permanent metal attachment. This can mean a stronger, more resilient repair and fewer future complications. Psychologically, patients are relieved. No metal under the skin, no second surgery, no constant reminder of injury. The goal is a return to normal life, faster and with less anxiety. Athletes may get back in the game sooner. Elderly patients may regain independence more quickly. Parents can lift their children again without fear. Bone glue isn't just about healing bones, it's about restoring lives. The path to recovery is now shorter, safer, and more complete. Bone glue holds promise for everyone, but some groups benefit most. Children, whose bones are still growing, avoid the risks of metal across growth plates and the need for hardware removal. Athletes gain from faster, stronger healing and a quicker return to sport, with less risk of re-injury. Elderly patients, prone to fractures and surgical risks, benefit from a less invasive, safer procedure and no second surgery. Those with complex shattered fractures, once difficult to repair, now have a better chance at full recovery. Bone glue lets surgeons piece together even the most challenging breaks, restoring function and hope. For these patients, the technology is life-changing. It means fewer complications, faster healing, and better outcomes. The impact is profound, especially for those most vulnerable. Bone glue is redefining what's possible in fracture care. Scientists and surgeons are excited about bone glue's potential. Researchers see it as a move beyond the carpentry of orthopedics toward living solutions for living tissue. Surgeons using bone glue in trials describe it as a revelation. Complex fractures stabilized in minutes, with unmatched precision. The adhesive flows into every crevice, restoring anatomy with a fidelity that was hard to achieve before. The medical community is cautiously optimistic, calling for more long-term data to ensure safety and durability. Experts stress the need for rigorous testing across all fracture types and patient groups. Innovation in medicine is a marathon, not a sprint. The future is even brighter. Next-generation glues may include antibiotics or pain medications, or be activated by light for perfect placement. Bone glue is not just a single invention. It's the start of a new platform for regenerative medicine. The consensus: this technology will keep evolving, improving care for years to come. The journey from lab to operating room is just beginning. The possibilities are vast. Bone glue is more than a new product. It's a testament to human innovation and our drive to heal. For centuries, we've improved bone repair, from splints to metal implants. Now we're entering a new era, mending the body with materials that mimic and enhance natural healing. This shift from mechanical repair to biological regeneration is profound. Innovations like bone glue inspire hope, restore dignity, and help people live life to the fullest. The impact is seen in children, athletes, and grandparents. Real lives changed for the better. As discovery accelerates, medicine is transforming from intervention to regeneration. Brilliant minds are building a healthier future, where healing is faster, safer, and more complete. The promise of medical innovation is a future where everyone can heal better and live stronger.